Welcome back to another video of Pearls of Medical Nutrition. And in this video, I'll be talking about vitamin D, its functions, its sources, and deficiency symptoms. Vitamin D, also known as the sunshine vitamin, is one of the essential fat soluble vitamins. It holds a very high significance in helping the body absorb calcium, which is necessary for promoting bone health and remodeling of bones. This fat soluble vitamin exists in two forms, which are vitamin D3, also known as cholecalciferol, which can be naturally produced in the body, and vitamin D2, commonly known as ergocalciferol, which are consumed through the regular dietary intake. Sunlight, especially the UVB rays, ultraviolet B, are the natural source of vitamin D. The sunshine vitamin is usually present in human body in biologically inactive form. The sun rays convert the cholesterol present in the body into cholecalciferol. Cholecalciferol is then synthesized in the liver into metabolite calcifediol, which further undergoes hydroxylation in the kidneys to give the biological active form calcitriol. Calcitriol circulates in the blood in the form of a hormone and plays an essential role in the absorption of calcium. Functions: Vitamin D, which acts both as a nutrient and a hormone, is quintessential element highly significant for a host of bodily functions, thanks to its wide range of therapeutic efficacies. Calcium, being the building block of bones, is absorbed by the body due to the presence of vitamin D, which is extremely beneficial in the natural growth and remodeling of bones. It reduces the risk of fracture, strengthens the bones, maintains overall body balance, and provides the body with a strong and perfect skeletal structure. Researchers also show the importance of vitamin D in getting strong muscles. Vitamin D is also essential for the dental health. It prevents tooth decay and loss, strengthens the gums, and reduces the risk of any oral infection. Vitamin D, being a fat soluble vitamin, plays a vital role in regulating the renal functions and protecting the kidney from any infections. It plays a major role in cellular growth, repair, and metabolism. A sensible exposure to sunlight is very effective in wound healing and repair. Vitamin D also plays a key role in reducing obesity and maintaining proper weight. The abundance of vitamin D in the body restores the function of the appetite hormone leptin, which gives you a feeling of fullness and reduces the tendency of snacking all the time, thus aiding in weight loss. Food sources: Although you can get a healthy dose of vitamin D through exposure to sunlight, some people do not get the required amount due to less sun exposure or other problems. But there is nothing to worry, as Mother Nature has blessed us with a multitude of dietary choices which suffices the vitamin D requirements of the body. Some of the food sources which are excellent source of vitamin D are vegetables like mushrooms, fortified foods like breakfast cereals, oatmeal, orange juice, soy milk, almond milk, cow's milk, and nuts. Animal sources like egg yolk, cod liver oil, salmon, herring, and tuna. Deficiencies: If you shy away from the sunlight or have a very poor intake of vitamin D, you might be at the risk of vitamin D deficiency. The sunshine vitamin plays a pivotal role in promoting bone health and maintaining the overall immunity. Lack of vitamin D may result in various defects, starting from low bone density to softening of bones and impaired mineralization of bones. These deficiencies lead to diseases like rickets. Rickets characterized by reduced growth and softening of bones. This disease is generally seen in children due to lack of vitamin D. Children develop very thin, deformed bones and a bowed backbone. Osteomalacia, similar to rickets, but is usually seen in elderly people suffering from vitamin D deficiency. This disease reduces the absorption of calcium in the body, leading to soft and deformed bone structure, bending of the spinal cord and legs, and increased risk of fractures. Osteoporosis. Osteoporosis being most common in elderly where the bone density reduces, making it more porous in nature and causing increased risk of broken bone and fractures. Apart from this, poor level of vitamin D in the body may also make you prone to infections, reduce wound healing, cause fatigue and weakness. Toxicity. Vitamin D, though extremely necessary for healthy bodily functions and maintaining the bone and teeth health, overexposure to sunlight or consuming higher amounts of vitamin D through food sources and supplements might be fatal to the body. As vitamin D is produced in the body, overexposure to sunlight may result in excessive production of calcitriol, which may cause toxicity and remain in the blood for several months. Excessive sun exposure may also cause severe skin damage and may lead to skin cancer. May also cause severe skin damage and may also lead to skin cancer. The sunshine vitamin is extremely beneficial for enhancing the overall immunity of the body and combating various harmful bacteria and viruses. A good boost of vitamin D supplements or foods rich in it is pivotal for treating upper respiratory tract infections like the common cold, sore throat, cough, and flu symptoms. The low levels of vitamin D often affects the activity of the neurotransmitter serotonin, making one anxious, stressed, and feeling blue. Hence, vitamin D, being an antidepressant, actively participates in uplifting your mood and reducing chances of depression. Researchers show that the normal intake of vitamin D through food sources or supplements is 600 international units. Anything more than the prescribed amount may lead to hypercalcemia, that is, elevated levels of calcium in the bloodstream, causing several health problems like nausea, vomiting, constipation, kidney problem, bone loss, etc. Hence, it is always advisable to take vitamin D supplements in a healthy prescribed amount or just enjoy the outdoors by taking a walk or participating in an outdoor sport to up your vitamin D level in your body.